Okay, it's just hit 2 minutes past the hour on my watch. It's 3 p.m. CET on my side, and I do understand that people are coming from all over the world. Our main audiences are African, but we do have people from the UK, from the US. I'm seeing familiar names. I'm in the audience right now, and I'm quite excited. And I just want to start by saying thank you so much for taking time out to join us, but mainly also just to thank our speaker for when I invited her for our February webinar. She was keen and excited and was like, yes, she's keen to do it. And obviously we've been having communication in the background. So I do appreciate Alice, and I'm going to introduce her now for agreeing to give our February webinar, which is the second webinar for HK Bionet for 2022. So I'm quite excited, and a lot of people seem to be excited in the audience as well. So welcome everybody. Good afternoon, good morning, good evening, depending on where you are. Please mute yourselves. That's one of the ground rules, by the way, before I even introduce a speaker. Kindly mute yourselves if you are not speaking, so as to not disturb our speaker, because it's going to be a bit of a challenge to hear a speaker if we all speak at the same time. So kindly mute your mic if you're not speaking. I will appreciate that a lot. So I just want to start by saying welcome to the February webinar, which is titled, as you can see on the screen, Capacity Building Strategies to Promote Equity in Genomics Research and Global Health. My name is Pablo Abel-Chauke, and I'm a training and outreach coordinator for HK Bionet. And one of my jobs is to lead a team of people, or a task force, that's responsible for organizing webinars every month. And for this month, I'm excited that Dr. Alice Matimba, who is the acting head of courses and global training at Wellcome Connecting Science in the United Kingdom, honored my invitation to give this webinar. So the webinar is going to be about 40 to 50 minutes. And at the end, we are going to have 10 to 15 minutes of question as well as discussion and comments. So please do respect the speaker that while she's speaking, you either type your question or comments in the chat box, or if it's a burning question, rather raise your hand instead of interrupting our speaker. So that's just a few ground rules. And just to let you know, we are recording this webinar today. We are going to make it available on YouTube. I'm going to send it out on email, and I'm going to put it on social media as well. But we're also live on Facebook. So the numbers that you see here are not representative of the people that are attending, because we do have a live audio or rather video going on right now on Facebook as well. I'm not going to read the whole abstract because of time, but I did send it out during advertising stages over the past few days. So please do go through that advert if you do need to read the whole abstract. But the title, as I said, is on capacity building strategies to promote equity in genomics research and global health. And this abstract was co-authored by people that I see in the audience as well, Dusanka Nikolek, Rachel Beckson, and Tisa Kravin, and they all work together at Wellcome Connecting Science in the United Kingdom. However, what I'll do is I will read a bit of Alice Matimba's, or Dr. Alice Matimba's illustrious CV, because she's done quite well for herself. She was a colleague a long time ago. She studied at the University of Cape Town, which is where I'm based. So Dr. Alice Matimba is the current acting head of courses and global training at Wellcome Connecting Science in the United Kingdom. She graduated with a PhD in human genetics from the University of Cape Town in South Africa, where I'm based, where HK Bionet is based as well. Because yes, we are based in Africa, but we do have a central node in, at UCT, which is where Alice studied her PhD. Thereafter, Alice pursued a pharmacogenomics postdoctoral research fellowship at the Mayo Clinic in the United States of America before joining the University of Zimbabwe's College of Health Sciences, where she focused on health education and research in non-communicable diseases, pharmacology, genomics, and ethics. Dr. Matimba is currently managing the computational as well as laboratory-based courses and the global training program at Wellcome Connecting Science. She's leading a team of education developers, event organizers, training technology experts, and laboratory specialists. What they do is develop and deliver a suite of genomics and bioinformatics courses, tools, resources for scientists and healthcare professionals. What Alice does is that she collaborates with Wellcome Connecting Science teams and global partners to come up with programs aimed at enhancing sustainability and impact for biomedical science and public health through the train-the-trainer approaches, blended distance learning formats for global audiences, professional skills, networking and mentorship platform development. Dr. Matimba's role focuses on stakeholder management and partnership building to foster collaborations, which is key to developing effective capacity development for genomics research applications in healthcare. Equity, diversity, and inclusion is central to her daily work, fostering skills development, empowerment, representation, as well as sustainability. Dr. Matimba is actively involved in designing and promoting implementation of strategies and policies that address global disparities towards equitable solutions to research and global health. I could literally go on for an hour reading her CV, and I don't want to waste more time. I just want to say thank you so much for honoring my invitation, Dr. Matimba. I'm really excited to hear your talk. Please go ahead and give your presentation. Dr. Matimba, you're on mute.
Okay, sorry. So yeah, thanks, Pabalo, and thanks everyone for joining us today. I have to admit that when I was asked to give a talk by Pabalo a couple of weeks ago, I kind of said yes, but I wasn't sure what I was supposed to talk about because I think this platform is usually giving a lot of talks around research and hardcore sort of genomics work. And so I had to think through what is it that people might want to hear about, and and I thought that our program of delivering training globally, and the strategies that we're using to make sure that we're doing the right thing would be of interest. There's some echoing somewhere. Okay, thanks. So I'm just going to jump straight in and ask, so I'm just going to jump straight in and start by asking you all to answer these questions. So you can answer only one or both of these questions. And if you could just type in chat, I can look at it later, or, we can have a short discussion in Q&A. I just want to know from your view, what is capacity building? And the second question is, why is genomics training important to you or your colleagues? So I'll just give you about 30 seconds. You can take longer, of course, but give you about 30 seconds to type that into chat. I just want to see what people think, what is capacity building, and or why is genomics training important to you or your colleagues? So I hope you just type in chat if you can, if you have, if you're on your computers. Are you thinking? Okay, Africa genomics for healthcare. Yeah, these genomics for healthcare. Genomics is the future. Okay, those are interesting statements. Any more? Please keep them coming. Keep them coming. More capacity for viral surveillance. Yes. Yeah, keep them coming. So I'll come back to this, but please keep them coming, just to hear what people are thinking when we talk of capacity building and talk of genomics training, and why we need this in Africa. Okay, so while you're entering all your answers, I will move on. So today's talk, I'm going to give a talk about our program, and also just emphasizing that our program has gone through a lot of name changes. So some of you might be familiar with different titles, different names, but I thought this would be an opportunity to sort of set that right and make sure that the way we're also being addressed is clear. I will talk about the courses and global training program, and I'll also talk about the capacity building strategies, which is really the core of this talk. Going through some of the values that we're following to make sure that we're reaching people, we're reaching global audiences, we are doing the right thing in the training environment. So Wellcome Connecting Science is based at the Wellcome Genome Campus, We are working alongside the Wellcome Sanger Institute. We are managed by the same company. However, we are slightly separate and, working particularly to work with researchers and scientists to connect other researchers, healthcare professionals, and wider public in creating opportunities and spaces to explore genomic science and its relationship with people and the world around us. A key objective of Wellcome Connecting Science is to impact careers, practice, and policy. And that's some of the examples I'll give today are really talking about how have people benefited from the programs that we are doing. We also have part of the Wellcome Connecting Science units has the program and strategy section. And we also have another group which is working on society and engagement, particularly around genomics. Our group belongs to the learning and training division, and I'm pleased to inform that we have our new associate director, Michelle Bishop, who's just joined us actually just about 2 weeks ago, and she's going to be working with us to continue to deliver the great work that I think we're doing, and alongside my other colleagues, Tressa, who's the head of conferences, and Rachel Bergson, who's managing the online courses, the online MOOCs, and I'll mention a couple of opportunities later that you can also join. So I'm going to talk about the Courses and Global Training Program, which is the main, sort of like the main talk in this session. So we fund, develop, and deliver training that span basic research, cutting-edge medicine, and application of genomics in healthcare. And as you all know, we've all had to adjust the way we work in delivering training, or during the pandemic. We've had to switch a lot of our training from face-to-face, which was the primary way of delivery, to virtual training. And we have a dedicated full-time team of developers, event organizers, IT and laboratory experts that have worked over the last almost 2 years to deliver over 30 virtual courses. So we are we've become experts in this, from novices to experts. And on the right-hand side, you have Aaron, who's preparing some demonstration to develop some virtual course filming. So we had to film quite a lot of demonstrations and run our lab-based courses quite differently. So he also developed some really cool skills on filming for virtual courses. So we've all benefited quite a lot from this situation, and we're now actually able to deliver our training in different formats, and this is actually going to be helpful in making sure that we reach even more people and have more impact. We have other projects that we're also involved in. So the Cochrane, which I'll talk about a bit later, and this is focusing on COVID genomics training. We also have a Tree3 Connect, which is focusing on building capacity for pathogen genomics skills in the UK, and the Sagessa project, which is focusing on developing networks for AMR and pathogen genomics in Africa. So I will touch a bit on that. But for now, I just want to move on to the global training program and give you a little bit more details about where we've been. So we collaborate. So basically, we run courses for everybody. And when we collaborate with experts and host institutions in Africa, Asia, and Latin America, and although we work with host institutions, we still invite people from anyone from that region to come to those courses. So of course, we're really looking forward to getting back to face-to-face. For now, we're still running these courses regionally, and it's been quite an interesting experience. Of course, it's not a big deal running courses within Africa in terms of time zones, but it is a big challenge, obviously, running our training in the other parts of the world. However, we're pleased that we have been able to do it and quite effectively as well. So the impact of our training is obviously quite interesting, quite diverse. We usually run an annual long-term feedback survey. So this usually runs for participants, for people that have participated in our courses at least 6 months to 1 year post-course. And we ask them how they have applied their skills. And as you can see there, quite a number of them have developed new research approaches, which is something that we really want to see. Attending the courses has really improved their understanding of the field and how to go out there and apply what they've learned, the new techniques that they've learned, but also optimized their design in terms of research. We also try to provide additional skills training that are not quite just around genomics. So these are skills around disseminating knowledge to others. And some of the past participants have come back telling us that they've delivered seminars, they've delivered lectures, they've been working with some of their teams at their universities to teach other students. They've also improved in how they interact with their peers. So in terms of how they communicate, scientifically with other scientists. And I think this is quite interesting because obviously it's not just about individual, how to do genomics, how to do analysis, but also how to interact with others meaningfully. And of course, it's nice to see that quite a number of them are giving back by mentoring others. So they're also increasing that capacity amongst other people in their own local environments. Even we go even further to understand what is the impact some of the training that we've provided has on some of the scientists that come to our courses. And Kenny Diallo has been on, I think, 2 or 3 of our courses. She has she's now currently also an instructor on one of our courses. And she's now actually leading some large research projects and really giving back, what she's learned and building that local capacity as well in some of the genomics techniques and applying them in infectious diseases. Tafumane Mashe from Zimbabwe has been found that he has attended, I think, 2 of our courses, and he has been very, excited to go back and share what he's learned, not only to his, to other scientists, but actually to policymakers. And this is something that we want to see how this training that we provide is influencing practice, it's influencing policy. And there are quite some really nice case examples of how he has done this. And I can direct you to our website to read more about this. So this is the kind of impact that we hope to see, obviously not always immediately, but if we can be able to start seeing such kind of impact after a couple of years, then we really know that we are doing the right thing, but it also informs us of how we can go back and improve on the current program. So moving on to the capacity building strategies that we are applying. And I just wanted to mention that it's always nice to know that, we are reaching, thousands of people here and there. And of course, my current philosophy is it's not so much just about how much we do, but also how we do it. So how are we making sure that we are applying, so some really important values to the way that we are working, to the way that we are interacting with people globally, to the way that we are delivering the resources that people need. So we have, we are following some really important values, and that includes making sure that we are inclusive, we are collaborating. We also really value innovation. So we know that we can never really reach everybody, that we want to reach. How can we do that better? So we are constantly trying to find ways of doing things better, and also making sure that we build in professional development skills as well as just sort of like genomics skills as well. And in all this, we hope that we are, applying a culture of equity and inclusion just to make sure that, again, like I said, we're doing it right. We're making sure that people that need to be included and involved are included. And in the end, this will really, really have an impact. So the first value is engagement and collaboration. We work with many people globally, in the UK as well, and also our main partners in Africa have been mostly just around the H3 Africa, and that's because it's the biggest organized network in Africa, and also I guess H3 Bionet, particularly on the bioinformatics training courses. We have received tremendous amount of support from H3 Africa through promoting our program, and working with a lot of the scientists on our courses, hosting some of our courses, and so forth. So we really like to keep those kinds of relationships going, because that's the best way that we can be able to really be doing, tailoring what is needed in Africa. And of course, we also engage with experts, so with experts from the region that are helping us to shape our program, to shape the content, to shape how we're doing things and making sure that we're reaching the people that we need to reach. And through these partnerships that we have, through these interactions with global experts, we are then indeed able to really reach out or access the most important stakeholders, which are the target audiences and the participants, so that we can involve them, directly or indirectly in the development process, in the development processes. So, for example, we have been currently been reaching out to scientists to develop, to understand what are the training needs in pathogen genomics. So we have a survey that has been going out since last year. And we have to admit that it was just a global survey. It went out to all the regions. And of course, Africa had the most number of people that responded. And George, who joined us a few months ago, mentioned that this probably because in Africa they have a better understanding of what is, some of these terms of bioinformatics and so forth, but it could also just be a language thing. But I think that, as you can see, we are trying to always build evidence around what we're doing, and that helps us that informs how we're going forward, even if, just to know that we're doing the right thing is also just really good feedback. So here we just threw in a couple of, just rough analysis on this data. And we are currently going to use some of this, we're going to be using some of this information to tailor the programs that we're working on, the projects that we're working on, particularly the COVID genomics training, but also to help us understand how we can better develop and deliver our other pathogen genomics courses that we've been running for quite some time. And it's also important for us to understand what are the different needs currently and what are the needs in future, so that some of the scientists probably at the moment, they need just the basic tools to get through some kind of pipelines and data analysis. And in future, people will be thinking about doing a lot more advanced stuff and, programming and, actual development design. And then also just noting that the needs for researchers are quite different from healthcare professionals, where healthcare professionals are probably much more interested in, practical things like I need to know how to prepare a sample for sequencing and understanding how to interpret the data, or, so I think having those kinds of that evidence with us is going to be helpful for us. But I also think this kind of evidence and data is going to be helpful for other training providers who are interested in understanding how to tailor content for the different audiences that we're targeting. So, so moving on to some of the innovations that we've developed over the last couple of years. So I'll mention, the way that we've been scaling up. I'll also mention how we've been developing champions who have been going back and, starting new networks, and also some of the digital resources that we developed to improve or to actually support all these activities that we are doing. So the first one is scaling up. So over the last couple of years, there's been an increase in number of people that want to have genomic skills and bioinformatics skills. And so, and just judging from, our applications of most of our courses, we're looking at a ratio of over 4:1. So of applicants versus people actually get selected to come on the courses. So that already was a red flag as to, well, we need to see how we can be able to reach more people. So, so that's how the collaboration with H-Bionet came about, because they obviously had thought about this much earlier, and they were already delivering the remote classrooms model and on various subjects, and we were interested in building this or collaborating on this to deliver the NGS bioinformatics course. And we ran the first one last year in 2021. We had over 400 people participating or registered. And just to mention that, we had more than 2,000 people who actually applied to be on this course. So that already tells you that, the scaling up model is definitely a priority to make sure that we are reaching more people. And, some people will attend, some people will want to attend again just to make sure that they're polishing up on their skills. So, so it will be a while before we start seeing numbers going down of people that need this kind of training. And then another model of how we are sort of innovating and helping to build capacity is through self-sustaining networks. So just, in fact, one of the things that we are also interested in strengthening is South-South collaborative networks, so that we are having more scientists, say, from Africa contributing to training in other regions, or scientists that are, or not just other regions in, in the South, but also even in the North. And I think that will be the ultimate, really. But also, we've been supported using the train-the-trainer model. We're also just supporting, champions who are able to go back, disseminate to others, teach others, share what they've learned, and then, establish something that is more longer lasting, right? So some of this has been inspired by the fact that a lot of people who come on these short training courses go back, and then they are again sort of on their own, isolated, not really able to continue working on, their skills, or even to try and establish collaboration. So we thought that networks are really at the core of capacity building, because if you don't have network, if all your networks are sort of one unidirectional, sort of Africa and maybe other high income countries, it's not really going to build the local communities. So we hope that by having sort of self-propagating local networks, we're going to be able to make sure that scientists in local environments are able to, one, get to know each other, get to know what people are doing, get advice from each other, come together, collaborate, apply for grants, and really build that capacity. So I have here Stanford Quendo, who's attended one of our Train the Trainer courses and has gone back to South Africa, the National Institute of Communicable Diseases. And we're supporting him together with our colleagues from the Big Data Institute, Center for Genomic Pathogen Surveillance, to develop a community that's interested in AMR and pathogen genomics. And To date, we have over 130 people that have joined this network. Initially, we thought it was just going to be targeted for people in Southern Africa. That's why it's SA, but it actually turns out that there's obviously been interest in other regions as well. And so we've opened it up to anyone that's interested in AMR and pathogenomics in Africa, whether they're based in Africa or not. And we hope that this will actually be quite beneficial in filling in some of those gaps that are within the communities around these topics. So Your Digital Mentor podcast is another resource that was inspired during the start of the COVID pandemic, where we had a lot of time and a lot of creativity, and we worked with Christine Boynet, who was working at the Wellcome Sanger Institute, to develop this really very important tool as a way of, again, filling in the gaps where we are not providing that much training around professional skills and so forth. And we thought that having a digital mentor, a digital resource that anyone could be able to access for free anywhere in the world would actually be something useful. So we have just been trying to collect some figures here of how many listeners. So we're reaching, hopefully we'll get to 10,000 soon, so that'll be good. But we are reaching globally, actually. And as you can see on the map, we still have a couple of gaps, and we hope that we can get a few listeners from some of the countries where we have some gaps there. But the idea of the podcast is really to discuss mentorship issues, to discuss how mentorship can impact on careers. We also invite some really cool guests, some of them you might know, and based anywhere in the world. And a lot of them are talking about their personal experiences. They're talking about real examples of how they apply or certain skills, but also giving tips on how to approach certain issues. And we've just completed season 2. And season 2 was really about skills development from, communicating with public audiences, to presenting skills, to grant writing, entrepreneurship. So I suggest that if you haven't yet gone to listen to Your Digital Mentor podcast, to search for it on your favorite podcast app and have a listen. And we think that having this kind of resource also helps to, spreading all these conversations so that people are not feeling alone, people are not feeling isolated, and that they get to hear from people in other places that, they are also, experiencing similar problems, and that they're not going through this journey alone in research, and keeping those communities engaged. So the third value that I mentioned earlier was around equity and inclusion. So this is the part I'm going to ask you again to write in chat, what is equity? And if you have time, again, what is inclusion? Or just answer one of them, whichever you're comfortable with. I'm just curious to know what people understand about what is equity and what is inclusion. So I'll give you about 30 seconds whilst I look at the other comments here. If there are any questions. Yeah. Okay, so if you could start entering in chat, what is equity and what is inclusion? And then we can move on. And I know that obviously it's actually just asking yourself, when you hear these words, what does it mean? What does it resonate with? Rather than the actual definition, but it's up to you how you want to respond. Okay, so I think one of the currently there's a lot of interest in the how to do some of these things. So everybody understands that it's important that we have solutions and resources that everybody can access. We develop things that are inclusive and so forth. And people are doing and applying some of this quite differently. So how do we promote equity and inclusive culture, particularly in the training environment? And we have policies that are really trying to make sure that we continue to have, that have emphasize on diversity, gender diversity, ethnic diversity, regional representation, and not only just among the participants that are coming to our courses and training, but also within the training teams. And we think that the people that are delivering training are, to a large extent, should be representative of the people that are whom we are delivering training to. So we've been quite active in making sure that we do not neglect the side of things, because even if we can reach everybody and make sure that everybody is sort of included and, from everywhere in the world, it's still not good enough if the people that are delivering these, these resources and this training are also not representative of the people that they're delivering to. So we have some policies in place. We're also quite, very strong about making sure that the teams that are developing and delivering this training are working collaboratively, so that it's not one-sided. You don't have sort of the people that know it all are the ones that are, doing all the work, and, the people and the rest of the people are sort of like falling behind. So we think that by working collaboratively, this can really build the skills and the capacity and the confidence for those that are interested in training to be able to deliver training as well in future. But I think one of the challenges that I can just mention here is that people are not always willing to give up the space. And so you'll find that having those conversations with the people we work with is always a lot more difficult than we think, because you would think that people understand this, but it's an area that we're working really hard to address. And you can see on the figure there that, it just means that equity just means that we make sure that the right amount of resources or effort goes to the people that need them the most. So that means that if we need to make extra effort to make sure that we have more more females, for example, then it means we need to put in more resources to support them so that they can also have the opportunities that are needed for them to be able to lead, for them to be able to take leadership. The same way for any other factor. So if it's regional representation, so it's sometimes very easy for us to reach people that are in countries where they're already well represented. So if we need to put in extra resources so that we can be able to reach those people, then that will really help to to bring them onto the table. So another sort of inclusive culture that we apply is making sure that we are talking to our stakeholders. So just like right now, talking to you, we are talking to you as our stakeholders. And it's really, we like to hear from everyone. We like to hear from you. We like to hear from people that have the know-how of the people who have the know-how, but also people whom we are actually also targeting for the programs that we are developing. So we want to understand, what do people need? We want to collect feedback. So what we're doing well, what we're doing badly, and how we can continue to work together, again, in this culture of inclusiveness. So in conclusion, I just want to talk about the meaningful impact. And I mean, we can translate, you can translate this in any way, but so my point was that by bringing all these collaborative strategies and, making sure that we are trying to keep up to date with the needs and innovations and inclusive strategy, we'll be able to really improve knowledge, we'll really be able to improve the capacity so that we have more locally or regionally led genomics research and translation, and also the training. And we'll be able to have self-sustaining local and regional networks, and that these will keep growing. And finally, decolonized genomics training that's shifting the, that dynamic tipping the scale really, so that we are starting to see more scientists from Africa taking that leadership. And I think we already see that happening. I mean, we work with a lot of scientists that are, you know, really taking that leadership. But I think what we want to see is to have more of that across all areas of genomics, and get to a point where, you know, some of the African scientists are actually the ones that are going and helping scientists in other parts of the world. And so that it's not just a unidirectional approach, which doesn't take into consideration that there are a lot of other local scientists as well, or regional scientists that are equally capable. And all this will contribute towards equity in genomics research and global health. So I will, before I close off, I just want to point you to some opportunities, particularly the COVID-19 genomics train, the COG train. There is currently an online course that's open at the moment. So I encourage you to go to the website and join the course. If you want any information about this, I have some of the developers of this program on the call right now. And if you type in, if you ask anything, they'll tell you, they'll give you the right links. So please feel free to ask any questions. We're also inviting people to sign up to Sagessa. We're hoping that this will be a very nice network. We're currently running quite a number of 2-hour webinars with a bit of interactive activities every couple of weeks. We're also planning a workshop that's dedicated to AMR, genomics and tools in May, and more information will follow. But if you join the network, you'll be able to get any updates on that. So if you go to sagessa.africa, there's a form for you to complete and to join. And of course, as I mentioned earlier, please listen to Your Digital Mentor podcast. So for all your mentorship needs, and you just have to search for Your Digital Mentor podcast on any of the podcast apps. And finally, we still have the NGS bioinformatics course that we're collaborating with H3A Bionet. It's still open. It starts in March. Please go and apply if you're interested in becoming a participant. Either you can find that on our website, but also on the H3A Bionet website as well. So I just want to acknowledge the team that's behind a lot of the work that I've talked about today, and just mentioning that we have the IT team that is really responsible for all of our IT activities in the team. We have a laboratory team, and we also have the courses and event organization, and members of the team that are really supportive. It's a small team, but they do a lot of big things in the background. And I think this talk wouldn't be complete without mentioning them as well. So finally, that's all I have to say to you, and open up for any questions.
Okay, thank you so much for an interesting and engaging presentation, Dr. Matimba. I really appreciate it. There's a lot of sort of comments in the chat, so I don't know if you have time to go through that, but people were sort of answering your questions about equity and inclusion, and also genomics in the beginning. And I think I did see some comment as well, which I'm going to have to slide up quickly just to see. But really, what a powerful presentation. And I think it's quite timeless. We do need such a presentation now, and I'm glad that we're recording it and that we can share it with people across the world through our YouTube channel and other sort of platforms as well. We do have time for questions, comments, and as well as discussion. We have about 15 minutes left before the hour. So please do raise your hand if you have a question, or kindly type in the chat box, and Alice will gladly engage with you. But just to say, I mean, over the years, I've personally enjoyed collaborating with you and your team. So I think I just want to say, yes, you are very collaborative. That's one of the things that you do at Wellcome Connecting Science. So you do sort of walk the talk as well. I have 2 questions, while other people are sort of thinking about their questions or comments. So the first one is about Sagessa. Is there sort of a joining fee to join? Because you say you're encouraging us to join. Is there a joining fee? Because I'm interested personally, but I want to know, is the money involved? And the second question is about, so for us at HUI-BioNet, as you know, because we've collaborated, as you said as well in your presentation, when the pandemic hit, so even though we've done blended learning models where we do have online training as a component of our training, either for IBT, Introduction to Bioinformatics, AGMT, and other training that we offer, the pandemic sort of rocked us a bit in ways that we didn't expect. That yes, we did have a component of online training, but we had to sort of adapt and also learn what it means to now be online and not have sort of face-to-face components in our training. And I just wanted to know, I mean, you did sort of mention it in your presentation as well, but I just want you to go into it. How did the pandemic sort of impact your training in both positive and negative ways? And would you, I mean, I don't know if this is the new normal or not, but if by a miracle COVID was to end, would you go back to the old way of doing things? Or would you continue with how you've adapted because of the pandemic? I'll stop there. Thank you, Alice.
Okay, thanks, Vabalo. Yes, so I'll answer the first question is the Sagessa. So just like any of the things that we develop, this is free. So you can join for free. Just like our courses are for free, everything that we provide is for free. We don't charge for any of the resources that we develop. And thanks obviously to to our to the fact that we're able to do it is really quite nice. And also on the Sagessa, I am working with Dushanka Nikolic and Isabella Malta, and they're both on this call. And they can add, if you have any questions for us, please just add them in chat and we can answer on that one. The second question about training and going back to whether we go back to normal or not, I think is very interesting because I think a lot of people, I think we're still split. So a lot of people would obviously still prefer to go back face to face because it has its advantages, but there are also other advantages when we run our trainings virtually, because sometimes other people are able to attend that couldn't attend. It is obviously also economically more beneficial. So I think that we are thinking about having something that is hybrid, but hybrid in the sense that some training will happen in person and some training will happen virtually, and probably rotate or switch depending on what type of courses they are. We think that having the lab-based courses running virtually is really a challenge. It really doesn't cut it. Although I think we've received some really excellent feedback from people, thanks to the team and trying to innovate around how best to do that. But we hope that, but it's been a lot more easy. It's a lot easier with the bioinformatics or data analysis type of training, because that just requires people to be online, and we set it up such that you have sufficient support, even remotely with the trainers or the assistants, as you know. So we're still thinking about that, and so we think that what the future will probably have a mixture of virtual training and face-to-face, just because it makes sense to do that. Yeah.
Thank you so much for that, Alice. I think we do need to obviously adapt and be agile and not sort of be stuck in our ways. Thank you so much for that answer. I see links in the chat. Isabella and Leah have shared the links to Sagessa, as well as the COOC training and the other courses that Alice was speaking about in the presentation. So thank you so much, Isabella and Leah, as well. We still have time, 10 minutes. So if you have questions, comments, please do raise your hand. Kindly tap in the chat box. And as you can see, Alice is excited to so please do sort of raise your hand or type, and I'll give you a chance to speak as well.
Yeah, I'll just, in the meantime, whilst people think about whether they want to ask me questions, I can just read out some of the responses. So we asked about equity and inclusion, and there are quite a few interesting comments here. So Jackie responds, including people of all denominators and abilities, and Pabalo, equity is not equality. They are similar but different, and equity goes deeper than equality and addresses the past in the present. That is true. And Sheikh responds, equity is same chances besides differences. And we have George, who says, I think fairness is a big part of equity. And Piv writes, inclusion means lowering barriers of entry and enabling access of opportunities to groups regardless of visible and invisible differences. And inclusion taking into account everyone, and equity, equal distribution of resources. Inclusion is actively including diverse groups. Equity is ensuring that all stakeholders, that's Nikki, says equity is ensuring that all stakeholders have fair treatment, access to opportunities and resources. Sometimes what is equitable may not be equal, in that it might be most fair for one stakeholder to receive more than another under certain circumstances. So yeah, so I hope this has been also been educative it's educative for me, but it's also educative for others, because sometimes when we are trying to apply some of these things, it's really important for us to understand, where we're coming from, why we're doing what we're doing. And also because for you to achieve some of these things, you have to convince other people to do it with you. And to do that, it means you have to be able to explain what you want to do and what the benefits are. So I think, and the easy thing is to just say, oh, it's too complicated, we're not going to do this. But I think just trying to understand it and find ways of working with others, or how to explain to others so that you do it together, because there is no way that we can be able to do all these things on our own. And that is why we're trying to always engage other people to make sure that we do it right in the end. Yeah, so.
Sure. Thank you so much. I wish my camera was on because you could see my head. I'm nodding my head constantly because I'm like, I agree fully and completely. There's a comment from Wisdom saying wonderful and informative presentation. And
thank you.
I echo those words. Thank you so much, Alice. We still have time for questions if people do have questions, but if not, I'm going to have to cut the webinar short by 5 minutes or so. Professor Nikki Tiffin says, thank you, Alice, for an excellent presentation. And I have to agree and concur with what Nikki just said now. And there are people getting hands through emojis. I don't know if you can see that.
Yep.
There's a standing ovation of sorts. Sheikh says, great talk. Alice, what an honor and a privilege for you to agree to give this presentation. And I want to appreciate your work. I think you're doing important work. And thank you for taking such a delicate topic, because I think science sometimes likes pretending that issues of equity and inclusion and transformation are not necessary. And I think you do it in such a professional and important way. So thank you so much. Really appreciated. People are saying thank you, Alice, in the chat. So there's tons of comments just praising you and really thanking you. And I don't take it for granted that you took time out of your busy schedule to come speak with us. So thank you so much, Alice.
Okay. Thank you very much, Pabalo, and thanks everyone for coming. And I hope to see you soon in person. I don't know when, but yeah, it'll be good.
Hopefully soon.
Get back to that. And don't forget to join and apply and spread the word and join our courses, join our networks, and hope to see you all soon.
So thank you so much. And to all our participants, we appreciate your time attending this webinar. I've recorded it. I'll share the recording with you soon through our mailing list and social media as well. And I'll see you at the end of March for a different webinar with a different presenter. Alice, enjoy the rest of your day and goodbye, everybody. I'll see you next month for a different webinar. Right. Thank you. Bye. Right.